we're sitting at a time now, record inflation, right? They're saying 6 point this, 9 point this inflation. We know it's more than that. However, we know consumer goods are going up in price. Everything is going up in price. But the individual practice owner who refuses to raise their self-pay or cash fee, they haven't raised it in 10 plus years.
Yeah.
And what do you tell the doctor who says, when it comes to that conversation, who says, "Oh, I wouldn't pay for that. None of my patients are going to pay for that. I can't raise my fees."
Yeah.
And they stay at an unprofitable fee schedule as a chiropractic practice. What do you say to that, doctor?
Get into another profession. Joke. I think that it's it comes down to the doctor valuing themselves, and I mean, a lot of our clients and doctors have spent, $250,000 in their education.
Mm-hmm.
Some of the old timers out there maybe spent, 80,000, but still it's a lot of money. And so, you got to value yourself, first and foremost. And so, but I can understand there's concerns on where a provider could think or a doctor can think, hey, if I raise my fees, I'm going to lose patients. And to me, you're just opening up room for new patients to come in. I would recommend you have a policy that you look at your fees every year. Like every December going into January, I would look at your fee schedule. There's a book called PMIC, PMIC, that actually tells you what you should be charging per your zip code. So it's about $150 for the book. It's well worth getting every single year because you adjust your insurance prices based on that. And the benefit of that is that if you ever are questioned on your fee schedule, you're like, well, I didn't make up my fees. I get them from PMIC, which is a national organization that sets the fees for what you should be charging per your area. That is really good for across the board if you're doing cash, but especially if you're doing personal injury work. That is something that a defense attorney sometimes will ask, like, where do you get your fees? Like, they're wanting to corner you thinking that, you're charging inappropriately.
Mm-hmm.
But when it's an easy handle when you actually say, hey, you actually get it from PMIC.
Yeah, that's great.
And so, I would look at your fees every year. And a tip that you can do is like, if you have a concern about patients dropping out, just say, listen, let's say your fees at 55 and you want to raise your fees to 65.
Mm-hmm.
You just go to your patients who are currently paying 55 and be like, listen, we're raising our fees to 65, but you can buy as many visits as you'd like for next year at 55. And what you'll find is you have a handful of patients that will actually buy 20, 30 visits at your current rate, but then you just, mark it in their chart like, hey, when they get through those visits, they're going to go up to that amount. And they're not as upset then because you're giving them the option to actually purchase at that lower rate.
Right.
But they know that's going to run out.
Yeah, that's great. 60 seconds. We're going to help you with your first associate pass your patients over with minimal attrition and a quick turnover. So Dr. Gary, what's the easiest way in under a minute to pass your patients over to a new associate?
It's really easy. It's probably one of the easiest processes that, and once you do it, you'll be like, why didn't I do this before? It's 2 visits with your associate. The first visit, you let the patient know, hey, I'm going to have associate so-and-so observe me treat you because I'm going to be leaving town in a few weeks for vacation. And when they treat you, I want them to know what's going on. So it's okay if they are in here in the room while I adjust you, and they're going to take notes. And while you're adjusting the patient, you go over contraindications, you go over how you treat them, the technique that you use. Great. You mark the travel card or you put it in your computer system that turnover 1 has happened. Turnover 2, next time the patient comes in, the associate is now going to treat them. You just say, listen, remember, I'm going to be leaving town. I want to have the associate treat you, and they're going to treat you based on how I treated you last time. So is it okay if they do that? You get their agreement, which they'll always agree 99% of the time. Have the associate treat them, and all you have to say is like, listen, is there anything else that did they do something different, or is there anything else you'd like them to have them do? And give them the opportunity to talk about it. That's it. Once that happens, and you've gone through, you take 1 month to do this, because if you have 1 or 2 monthers,
Mm-hmm.
Once you've gone through that, take off for that week and never come back.
There it is. Awesome. And then for those patients that absolutely got to have you as their doctor. So you pass over 98% of your patients or 80% of your patient load for those extra 10, 25% of those patients that still want to be with you, because the majority will be fine, the handful. How do you handle that in your schedule, right?
So a couple things you can do. First off, what I would recommend you do is you raise your fees. You as the owner, raise your fees higher than your associate. So if they still want to see you, then you're getting paid more for your time. And then I would just schedule like a one shift a week where you'll see those people. They say, it's fine, you can still see me. I'm treating for 2 hours on Tuesday afternoon. That's when you can see me. And instead of 60 a visit, it's 120 a visit. And if you like to do that, you can schedule that.